Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Controversy over confirmed COVID-19 cases believed to be indigent of Kogi State. State government distances itself from result. NDDC shuts down operations following death of finance director believed to have died of the coronavirus. And hundreds escaped from COVID-19 quarantine center in Malawi. When the coronavirus pandemic broke out in Nigeria, the index case was an Italian who flew into the country through the Murtala Mohammed International Airport. So it was not surprising that the government, in curtailing the spread of the virus, immediately imposed a ban on flight operations in and out of the country. This was followed by a ban on local flights as well. With talks on how to regalvanize the economy, the aviation sector will reopen operations, which is why the Nigerian Civil Aviation Authority, NCAA, is considering flight protocols. In the middle of the COVID-19 pandemic, we analyze the strategies in the course of the program. And according to the Nigeria Center for Disease Control, NCDC, one new state recorded a confirmed COVID-19 case in the last 24 hours. That's Kogi State. And following the 389 cases of COVID-19 infections, the latest in the country, the total cases now stands at 8,733. In the meantime, 2,501 patients have been discharged and 254 deaths recorded. A breakdown of the figures by region shows that Lagos in the southwest has the highest number of cases at 4,012, followed by Kano in the northwest with 936. The Federal Capital Territory is next, and it has the tally of 519 cases. Borno leads in the northeast with 257, Edo in the south-south with 240, and Ebonyi leading in the southeast with 36 cases. In continuation of the Presidential Task Force briefing on COVID-19 today in Abuja, the Chairman and Secretary to the Government of the Federation, Mr. Boss Mustafa, once again identifies collective responsibility as a vital tool in the fight against COVID-19. Mr. Mustafa confirmed that Nigeria is working with ECOWAS in controlling the spread of the virus.
The Presidential Task Force will continue to appeal to all Nigerians on the need for taking this fight with utmost diligence. It is for self, it is for your family, and it is for the whole community. On our part, we are sparing no effort in coordinating the national response, collaborating with all necessary stakeholders, and supporting subnational entities in their individual state responses, which we always maintain should be in synergy with the national response. Today, the Presidential Task Force expanded the scope of collaboration and experience sharing to the ECOWAS region. This is in keeping with the role of Mr. President as the ECOWAS COVID-19 champion. This interface through the West African Health Organization WAHU will be deepened as part of the short, medium, and long-term objectives for controlling the pandemic. The essence of this regional effort is underscored by the huge population of Nigeria and the trade activities across the borders.
Okolo is joining us.
For the Minister of Health, Dr. Osage Hanure, there is no need to rush with the screening of the Madagascar medicine, calling for patience on the outcome of the verification procedures.
Global efforts to find a cure for COVID-19, in which Nigeria is participating in the WHO Solidarity Trial, will be reviewed by our panel of experts, as WHO suspended some aspects of the trial due to alarm raised by a medical journal on the safety of some drugs being tried like hydroxychloroquine and chloroquine, or their combinations. The Madagascar herbs have been received at the Federal Ministry of Health and were found to consist of 2 varieties, one variety labeled to be for prevention and the other labeled as for treatment. Samples have been given to or are to be given to 3 agencies of the Ministry of Health and also to the Ministry of Science and Technology. These are all normal processes for new preparations to be approved for use in Nigeria and they include toxicological and efficacy tests and clinical trials. Government will investigate all genuine efforts to find homegrown solutions to the pandemic.
The Niger Delta Development Commission's office, NDDC, in Port Harcourt has been shut down for 2 weeks following the death of the Commission's Director of Finance and Administration, Mr. Bassi Etang Ibanga, from COVID-19 complications. All members of staff of the NDDC have been asked to embark on 2 weeks self-isolation. The Commission plans to also carry out fumigation and decontamination exercise in all its offices and premises in the headquarters. In the meantime, the NCDC officials have also buried another COVID-19 patient at the Port Harcourt Cemetery in River State. He's identified as the council chairman of Asari Toru local government area, Mr. Odiari Prince Will. The burial was carried out under strict supervision of the COVID-19 task force in line with the NCDC protocols. Kogi State government says it has conducted hundreds of tests for COVID-19 and so far all have returned negative. The Commissioner for Health, Dr. Saka Haruna Audu, says the state will not bow to pressure from outside over fictitious COVID-19 claims, as government only recognizes tests conducted within the state supervised by the Ministry of Health, according to Dr. Haruna Audu. We have also continued to insist that it will not be a party to any fictitious COVID-19 claims, which is why we do not recognize any COVID-19 tests conducted by any co-guides outside the boundaries of the state, except those initiated by us. Any attempt to force us to announce a case of COVID-19 will be vehemently rejected. The state says it is more than prepared to secure the lives of residents, as they have no interest in playing politics with their health concerns. In the meantime, the Director General of the NCDC, Dr. Chikwe Hekwazo, at today's PTF COVID-19 briefing in Abuja, dismissed claims by the Kogi State government that the persons who tested positive for COVID-19 are not from the state. Responding to questions from Channels Television's correspondent, the NCDC DG says there's no confusion about those cases because the reference addresses given by the patient is Kogi State.
Couple of days. I think everybody is working very hard to resolve this issue. There's actually no dilemma in the 2 cases. They followed absolutely normal practice. This were a patient that was referred from the Federal Medical Center to the National Hospital. This is a normal referral pathway when you have a case. The physicians in the National Hospital, I don't have any influence over the work that they do. They suspected COVID-19 based on the clinical symptoms of the patient. Did it ask for a test? The test came out positive. The individual lives in Kogi State. Everybody's in what we do in public health. Your public health response is based on where you live, because that's where your contacts are. So this is not controversial in any way. Standard practice was followed. Once the results came out, the state epidemiologist was informed that he has to do contact tracing around this patient. It is the state's responsibility to do that contact tracing. So we hope they do it. There's nothing actually controversial in any way about this. It's all standard, fairly standard practice.
Health workers on the front lines in Taraba State are clamoring for an increase in their hazard allowances to spur them to efficiently discharge their duties. They made their stand known through the state chairman, National Association of Nigerian Nurses and Midwives, Comrade David Nanushe, when they donated personal protective equipment to hospitals across the state. According to the chairman, health workers in the state need to be extra careful to avoid getting infected with COVID-19.
talking of the hazard or allowance of health workers should be increased. And we actually agree with them to do that because that will actually ginger all the workers to put in their more efforts and be happy doing the work. It's a teamwork. Definitely we have a concern for them. And we've just started. Probably on the next visit we will do something like that to other health workers as well. We need to be extra careful. We need to know that he's still living with us because not all of us in Nigeria or Taraba have been tested. So it's possible someone will be carrying it and you don't know because it's not written in your face. So we need to be careful and take all the precautionary measures that have been given to us in most of these sensitizations.
Nigeria-based flight crew must now wear personal protective equipment, PPE, observe infection prevention and control measures for the duration of all international flights. The Nigerian Civil Aviation Authority, NCAA, released a post-COVID-19 pandemic public health protocol for Nigeria-based crew members. Now, the protocol also states that the flight crew will not be quarantined but undergo the mandatory testing for COVID-19 every 14 days. At a cost to their air operator upon return to Nigeria, as the crew members who test positive for COVID-19 will be taken to a treatment center for further management. In a letter signed by the Director General, Captain Musa Nuhu, to all operators, airports and other service providers, the new protocol approved by the Federal Ministry of Health, they say, replaces the current practice where Nigeria-based flight crew members who operate international flights are quarantined for 14 days upon their return. Well, in the wake of the pandemic, what is the future of air travel? Joining us in the studio is Dr. Paul Akon, who's a public health physician. We'd like to welcome you to the program.
Thank you very much, Millicent.
All right. How easy is it to observe infection prevention control measures? And this is for air travels.
Air travel and air transportation generally is the fastest mode of transportation and arguably the safest. And it is highly regulated. We have the International Civil Aviation Organization that is saddled with that responsibility. About 193 member countries, and each civil aviation authority in each country is a representative of ICAO at the national level. So they are saddled with regulation of safety. The objectives of ICAO is to make sure there's flight safety and well-being of individuals. So it's actually something that is expected. The regulation is not just Nigeria, it's actually global, and it has to be put in place.
So looking at how we're handling this pandemic, this definitely affects a lot of things, and that's also the future of air travel. What do you think that we should do? How do we look at ways to prevent the spread of coronavirus? And this is also trying to ask what were our modus operandi for outbreaks we've had, in the past.
What happens in this case is a lot of measures have been put in place. Air travel is not going to be like before. There's going to be a lot of screening, a lot of multi-layered screening. Even before you enter the terminal building, a lot of security checks, and this is a time to be very, very careful. And these measures that are advised are not different from the measures that are applicable in other forms of transportation or common day life. Like wearing of face mask is a must. Coming to the airport, you have to put on your face mask. You have to make sure that you your luggages are well protected. Of course, they'll be sanitized, and it's not such an environment that you just go on barefooted, because when passing through the security screening, you may be asked to remove your shoes, and if care is not taken, you may contract infection. So this is the time to wear socks. Multi-layer screening, but the most important thing is that a lot of measures have been put in place. Like the NCAA protocol talked about the PPEs for cabin crew, the pilots undergoing screening. In the same way, the aircraft environment is such that is HEPA air filter, that is high efficiency particulate air filter, has been put in place in such a way that the risk for transmission of COVID-19 is not significant.
All right, that's a rather interesting point of view there. But we'd like to appreciate your time, Dr. Paul Akon, a public health physician. Thank you for throwing light to this issue.
Thank you very much.
We have more on the COVID-19 updates when we return. Welcome back to the program. We have a guest joining us right now from the United Arab Emirates, Dubai, to be specific, Dr. John Oluwole. He's with the King's College Hospital, London. He's a specialist neurologist. I hope I got that right. Welcome to the program.
Yeah, thank you so much.
All right.
Yes, that's correct.
All right. Tell us what's happening in the United Arab Emirates, especially, in the fight of COVID-19.
Well, a lot has been happening in Dubai since the pandemic broke out. UAE obviously was one of the countries that started the lockdown, and they shut down schools first. And so that really helped us to curtail the spread of the virus. So the schools were shut quite early. The pupils were sent home. And then gradually, as cases began to increase, more measures were introduced, like gradually making people work from home, and then ultimately culminated in total lockdown as cases began to escalate. And well, right now, things are getting better. The country is beginning to open up gradually.
All right. How much measures in terms of the physical distancing and the provisions of the diagnostic tools are you getting, especially as a frontline worker in Dubai?
Well, I must say that the government of UAE, they have done very well in this regard. They deserve a lot of commendation. I think they are probably one of the countries that are doing the best. The best things in terms of mitigating this pandemic. In terms of testing, they have the capacity to test up to 10,000 people in a day. And there are several drive-through testing centers where citizens are encouraged, or residents are encouraged to go to drive-through and test themselves. And on a daily basis, we get, like today, about 560 cases were confirmed positive. So the testing is really going on at a very, very high level. And social distancing is enforced as well. In the malls, for instance, the grounds are marked. So you cannot go too close to the person in front of you. The ground's already marked where you're supposed to stand in relation to the next person. And then universal facial face masks are really enforced. So I think the government is doing quite a lot. And then there are isolation centers scattered all over the cities where people who test positive are isolated so that they don't spread the virus to those who are not yet contaminated. So they're doing quite a lot.
With all that you've mentioned, what's your assessment of Nigeria's response to the pandemic?
Well, I don't want to be too critical, but apparently there's a lot more to be desired. The response from Nigeria isn't yet up to the mark. Apparently, there's a lot more to do. I will stop at that level, and then I think universal face masks will be enforced. And I think some of the reports I've got of the enforcement, I think some of the things that we've read in the news aren't very encouraging. I think the law enforcement need to be a bit more sympathetic towards the people. Like we've read of instances of doctors being assaulted by military personnel in spite of them showing their identity. But the case is completely different in other parts of the world. So I think that's the much I want to say about that. I don't want to be too critical of what's happening in Nigeria.
Let's quickly ask you if there are any plans, the UAE, with regards to vaccine, finding a solution to COVID-19.
Well, I think in terms of vaccines, I think the US and Europe are taking the lead in that regard. I know the European Commission is doing a lot of fundraising right now, and the US also trying to sponsor some candidate vaccines. For UAE, I'm aware we're doing some research on stem cells to see how that can help, stem cell infusion, how that can help reduce the severity of infection and help improve recovery. And we're beginning to see results. Like my hospital, King's College Hospital, is going to be involved in the in some aspects of the research, and that's going on. And that's the contribution we expect from UAE. That's a novel approach to treatment.
All right, we'd like to appreciate your time. Thank you so much, Dr. John Oluwole, a specialist neurologist with King's Hospital London in Dubai. Thank you for joining us.
Thank you.
In response to the coronavirus situation, the federal government is giving a temporary employment to 1,000 persons each from the 774 local government areas of the country. The Minister of State for Labour and Employment, Mr. Festus Keyamo, broke the news in Abuja today, saying that it is the president's way of ensuring that employment reduces in the country. He says that the government has embarked on massive job creations aimed at reviving the nation's economy. According to him, the participants are to be paid 20,000 naira and are to be recruited largely from the pool of unskilled persons resident in rural areas.
Sometime in October 2019, President Muhammad Buhari, GCFR, President and Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, approved a pilot special public works program in the rural areas. And arising from the need and desire of the federal government to create massive jobs at the lowest rung of the economy, the pilot program, earlier approved by Mr. President, was designed to mitigate lack of job opportunities in the rural areas through a short-term engagement of 1,000 unemployed persons per local government area for a period of 3 months. Participants were to be paid an allowance of 20,000 naira monthly, and we are to be recruited largely from the pool of unemployed, unskilled persons, ordinarily resident in those rural areas. Now, you will recall that on Monday, the 6th of April 2020, the Honorable Minister of Finance, Budget and National Planning, in a press conference, announced the approval of Mr. President for the extension of this program to all 36 states and the FCT from October to December 2020, as a means of mitigating the effect of the COVID-19 pandemic on the economy.
And according to the Nigeria Center for Disease Control, taking ownership and collective responsibility is important as we fight the virus. You can find the latest guides on their website. As the center continues to work closely with states, you can find the latest national strategy to scale up access to testing in Nigeria. The World Health Organization also has the latest updates on the global response to the COVID-19 and indeed the national and subnational levels. It includes practical guidance for strategic action that's tailored to local context. ChannelsTV.com, our website, has more updates. You can find the latest on the pandemic in Nigeria across the world, plus other stories. That's a COVID-19 update. Another update comes your way again at 9. I'm Millicent Wonka. Stay safe, stay healthy.